guys, welcome back to my channel. If you're new here, welcome. My name is Bethany. As you can probably tell from the title of this video, I am having surgery. I want this surgery. I've been on a waiting list for over a year. Let me tell you all about it. I am getting my wisdom teeth out. I've had a lot of issues with my wisdom teeth over the years, and about a year and a half ago I was referred to the hospital by my dentist to get them all out. He couldn't do it because one of them is growing along the nerve and he did not want to touch it, so he said we'll send you to the actual surgeons. About a year and a half and 3 infections later, I am finally getting them out. I got the call the other day that my appointment is in 2 weeks. I have my pre-op assessment next week, and then the week after I'm getting them taken out. Kind of nervous, but they've been causing me issues for so long that I do just want them out. This video is gonna be me prepping for the surgery, the actual surgery, well not the actual surgery, but like hospital, and then also my recovery, which I don't know how that's gonna go. I'm supposed to have a responsible person take me home from the hospital and stay with me for 24 hours after, and I don't have that. I have someone who's able to take me from the hospital to home, but I don't think I have anyone who is able to stay with me for the first 24 hours. I guess we'll cross that bridge when we come to it. I know that I'm not going to be able to eat a lot of foods. I'm not going to be able to drink with a straw. I can't brush my teeth for the first 24 hours after the surgery. I did order something to help me with my recovery. It came yesterday. I know that I'm going to be looking so good when I put this on. Oh no. This is what I bought. It helps with wisdom tooth pain, facial surgery recovery, also migraines and TMJ relief. I don't know what TMJ is. It's hot or cold therapy, hopefully to help with swelling. Oh, this is so, I mean. It's a good look, isn't it? It's a day surgery, so I'm hoping I'll be out by mid-afternoon. I have to be there for 7:30, but I can't eat after midnight the night before. I think I'm working a late shift that night, so I might just order a pizza when I get in, as well as have like my normal breakfast, lunch and dinner, and just have like extra food in my stomach so that I'm not mega hungry the next day. It's not my first time having surgery. I've had surgery on my foot before, and that was general anesthetic, and they gave me the option this time to have local, sedation or general, and I was general all the way. I was never going to have my wisdom teeth taken out with anything other than a general anesthetic. I'm getting them all out. This one's caused me the most issues. I had a phone call with him. He asked me if I had issues with any others. I said this one's starting to be a bit painful and the top ones are just in the way. Basically, I've been told there's not enough room in my mouth for all my teeth. Like, I do bite my gums quite a lot. It's hard to clean behind the wisdom teeth. So he said, well, should we just take them all out? And I was like, okay. It might be harsher on me, but I may as well get them all out if I'm going to be under, if they're all causing little problems. I'm quite nervous. They've told me that infection rates are reduced if you are warm. So to stay warm while I'm in hospital, I mean, A, hospitals are always warm, and B, I'm going in at 7:30. I was gonna be dressing warm, so I'm gonna take a blanket with me. They also say to bring a clean dressing gown and slippers. I most likely will still be in my moon boot, which is kind of awkward. I'm glad it's finally here, and the hospital's closer, because they were thinking that they'd have to send me to a hospital further away because of wait times, but luckily, get me wherever's quickest. Turns out the one closer to home is quicker. Enough of me yapping. So it is the 27th of September. I'm about to head to my pre-op assessment. Hiya. Thank you. You too. Hiya. Got an appointment at 2.
What was the name?
Bethany.
Are all of your details still the same? You haven't
Yes.
changed any telephone numbers?
No.
Just like this.
Thank you.
Arranged on Tuesday. We'll talk about it on Tuesday.
Hiya.
Hi, you ready?
I'm back from my appointment. They gave me loads of bedtime reading. Let's see what this one says. It says pre-operative fasting guidelines. I don't like this one already. For a morning list, which is what I am. No solid food after midnight the night before your operation. So I will be getting a pizza when I get in from work the night before. You can drink tea or coffee with a little milk before 6:30 on the morning of your operation. No, I don't drink tea or coffee. And she said no for hot chocolate. You can drink plain, non-fizzy water up to the time of your operation. Now, I hate plain water. So this is not going to be fun. I also have to stop taking my Lemmy supplements tomorrow because they advise that, like, you don't do any herbal 2 weeks before your surgery. My appointment was a week before, so that's not helpful. Attending the surgical day unit for your operation. Let's see what's in here. Why would you wear makeup when you're going in for surgery? Tell me that. Ideally, removing nail varnish is helpful for vital monitoring during your procedure. However, if you have gel nails that are hard to remove, it is not necessary to do this. Now, I do have gel nails, so I don't need to do that. You'll be asked to remove all jewelry for your operation. I hate taking this piercing out because I can never get it back in. She also said that I need to bring warm socks, a dressing gown, and slippers. This is me. So I need to remember to bring my medication with me, and she said that I need to bring them in the original boxes. And this says omit all herbal or complementary medicines on the day. She did say 2 weeks, so I am just going to go with what she said. I will either edit or listen to music. I may also bring a puzzle book. Oh, I might get a red bracelet because I'm allergic to certain medications and latex. I'll be speaking with the anesthesiologist beforehand as well. You'll be given water to drink in recovery. That's going to be fun. Ooh, I'll be able to have a hot drink and toast/biscuits. I'm not going to be able to eat. That is it for today. I will see you when I pack my hospital bag. It is Wednesday evening. It is 5:10 and my food shop has just been delivered. Really depressing, but this is all I'm going to be able to eat after I've had my surgery. As usual, I've got the shakes that I have for my breakfast because, you know, liquid, I'll be able to have them still. A 4-pack of cream of chicken soup, orange juice, custard, raspberry jellies. This is so depressing. Frubes, raspberry sorbet, raspberry and cream yogurt, more custard. That really depressing haul is what I'm going to be eating from Friday onwards. See, if I was just having one out, I could eat on the other side, but because I'm having all 4 out, yeah, it makes it more difficult. I'm gonna pack my hospital bag in a little bit. I'm now gonna pack my hospital bag. I'm gonna be using this bag from Amazon. It's kind of like a Bays Weekender dupe. I'm gonna take this blanket as another way to keep warm. Then they told me to bring a dressing gown, so I'm going to bring this one with me. They also mentioned fluffy socks, so I'm going to bring these ones to keep my feet warm because my feet actually get really cold. I'm going to be bringing a 3-meter cable and a plug, but I'm going to be using that plug tonight and tomorrow night, so I'll put that plug in on Friday morning. I also need to bring the boxes that my medication originally come in. I'm going to be bringing the limited amount of toiletries I'm bringing in this. So I'm bringing a scrunchie, a lip balm, and moisturizer, but I will be using that moisturizer tomorrow and Friday morning, so I'm gonna leave that out for now. Then I'm gonna be bringing this lovely piece of equipment, I don't know, that I'm gonna be needing after my surgery. I think I'm gonna bring it in the box because I have not read the instructions. This is coming. And then I'm bringing my slippers as well. I'm not bringing toothpaste or mouthwash or a toothbrush because I read that I'm not going to be able to brush my teeth for 24 hours after my operation. Then I'm also going to be bringing my AirPods so that I can edit videos before my surgery and if I'm lucid enough afterwards as well. But we'll see about that. Let's pack the bag. And then I'm going to bring my Stanley with me and put it in here. I am basically ready to go on Friday morning at 6:30, 7. You might be wondering why I'm packing today. Well, I am doing a 12-hour shift tomorrow. I'm probably going to get in about 9, half 9. I just didn't think that there would be time or that I'd have the energy. I also want to order a pizza when I get in from work tomorrow because I'm not allowed to have anything to eat after midnight. And I know that if I don't eat from 7:30 onwards, I'm going to be starving 12 hours later. So tomorrow evening, my plan is to finish work, get back here, get a taxi back here, do my cat's food, order pizza, have a shower, and then go to bed. I don't know how much filming I'm going to be able to do in the hospital on Friday. I will probably bring my old phone so I can edit on that one and record on this one because I still don't have a camera. I think this is pretty much it. I might take some tissues actually. Moisturizer is a must because my skin gets so dry in hospital. But I am now gonna repack this for a TikTok because I only have one recording device. I might see you tomorrow night with my pizza. If not, I will see you on Friday morning when I get ready for my surgery. I can't believe it's 2 days away. Less than 2 days. This time in 2 days, I will have 4 less teeth, which is insane. I'm getting quite nervous now. It's Thursday morning. I'm not going into work today because medication never arrived. Been up since 2:30. I'm shattered. No concentration, thumping headache. So I've taken a sick day. Hi. Hi. So I forgot to mention the other day that I also bought Corsadil to help reduce infection afterwards, and a sensitive toothbrush, which will hopefully be good when I can finally brush my teeth again. It's 6 o'clock. I know I said I'd be having pizza like late night, but because I'm not at work, I'm gonna have it now and then just have snacky bits later. I did get a medium as well. Oh yeah. And then a cookie dough. Oh, good morning. It is 5:20 and I'm about to get ready. I'm already hungry, which doesn't bode well for the rest of the day. Before I make my bed, there's one thing I want to put on my bed because I hear that you kind of have to sleep sitting up a bit after the surgery, so I'm going to go get my back pillow. I'm ready for when I get back. Let's go get ready. My sweatpants, that cozy top, and my hoodie. I'm gonna go do the cats breakfast, get them ready, do their litter tray, and then get myself ready, and then we can go. This is my last morning with all my teeth. A short interval from your regularly scheduled programming. It is official that Kobe is the spider catcher. No word of a lie. I heard a noise and Kobe ran out from here chasing a spider that was, I'm gonna be sick talking about this, that big. Stormy went over to see what he was doing. I think it must have touched her legs and she ran. Kobe followed it all the way around to under there and he was trying to get it, but he didn't. And now I'm terrified. The piece of paper said that I could have tea or coffee with a little bit of milk before 6:30. As you can see, it's before 6:30. I had a little bit of milk. After that milk, I don't feel as hungry, which is brilliant. And I kind of want to get out of this room now. So let's go get ready. I realised that I forgot hand cream. So I'm going to take that with me. And then I'm going to head out because it is 6:45. I'm not going to wear my boot because I feel like it's a bit overkill and my foot is getting better. Bye. Love you both. Be good. Have a good day. And I'll see you when I get back. As it gets closer to it, I'm like getting more nervous, but it should be fine. Hiya. Yes.
Removal of all times 4 wisdom teeth. And we're doing it for relief of pain infection.
Yeah.
Or wrist, there's a nerve that runs through the jaw, spice sensations of the chin and the lip.
Yeah.
You can see that on the x-ray, so we should be able to keep well away from it, but there's always a small risk. So you're probably going to have to sleep for all this.
Mm-hmm.
Me that's doing it, Mr. Evans James. Away from latex, and you're going to be the first patient on the operating list.
Perfect.
Just in case anybody else took latex in there afterwards, then
Okay.
you know we get you done first.
Brilliant. Thank you.
You don't need to mark you because you're everywhere.
Yeah.
So,
Brilliant. Thank you.
second time this particular person has done this and nearly given me
Was it
heart
Phil?
failure. And it was Phil.
Sorry if I'm talking weird. I started bleeding, so they gave me gauze to. Giving me spare as well.
Are you stitched or not?
I'm not sure.
Did I go back?
Didn't say.
Oh. There's no follow-up.
I'm assuming not. Becky didn't have one when she had her tooth out.
You got antibiotics?
Didn't need them. Dude, I was flying. Oh, dude, I can't believe I cried when I came around.
What were you saying about Granddad?
I just said, like, at least I'm not as bad as when he came round and he thought he was back in the war and then thought he'd won the lottery and hadn't.
Oh, I didn't know he thought he'd won the lottery.
I'm sure he thought that one. 2 minutes later, I was, like, starting to cry and I was like, can I have a tissue? Hi, bud. Are you my nurse? Still got dried stuff on my head from where they put that. It is now 20 to 1, I think. My mum is in the lounge. We've just been catching up on TV and talking a lot. We spent like 3 hours talking in the kitchen, which was really nice. I think there's quite a bit of swelling, specifically on this side, but I think they might have had to take the gum back because, like, to see the nerve properly. I have been in a lot of pain, so I'm going to take a codeine. I've already had paracetamol and ibuprofen. I'm going to try and go to bed because I've been, like, getting waves of tiredness all afternoon. I'll probably watch a little bit of the new Unsolved Mysteries for a little bit and then head to bed. What I've had to eat today is a custard, a jelly, and a little mini Ben & Jerry's pop. I do have another custard here. I will see you in the morning. I forgot to say it has been bleeding on and off. They gave me gauze to bring home just in case, so I've been putting that in and it's been helping. Is to, like, open my mouth, like my jaw. The top two are fine, they've not been hurting me. It's the bottom two that have been hurting me. I'm going to finish my custard and watch a bit of Unsolved Mysteries and then I'll see you in the morning. Good morning. It is nearly 9:10. I'm in a lot of pain. I've had Oromorph. It's not really kicked in, so I'm going to have tablets as well. My mum's just gone.
Bowlers in the parks, all walks of life visit these parks. Friends down there a lot.
At 5 o'clock, there's so much traffic.
So I think Stormy has decided it is her turn to be my nurse today. You can look after me. Oh! Well, apparently I did watch all of this last night, but apparently I also watched up to episode 4, so definitely fell asleep during it. Let's finish this episode of Unsolved Mysteries.
Very unlikely motive because the victims had his cell phone.
Hi, cutie.
You know, there's just clear signs that anybody was having a heart.
It is like 10 to 1. I've been in and out of sleep all morning and Kobe has just been on me. He's now trying to start a fight with his sister because it's now been, well, it's over 24 hours. I'm gonna go and rinse my mouth out and brush my teeth, which I'm not looking forward to. I think he wants to be in the bowl, but Stormy was in there first, so he's being a little bit mean. He's being a cheeky boy. I'm gonna use the Corsadol first. Okay, here we go. I'm so nervous. That was delicious. Got my sensitive toothbrush, so I think this is like a soft bristle one. It is. The swelling's quite big there. Wish me luck. My cheeks down here, like on the inside, feel very, like, inflamed. Like, they just feel very big. I'm gonna wash my face, but maybe I'm not. My jaw is, like, very sore. I'm gonna change this out for cold. Hopefully I'll be able to talk properly soon. I feel like I'm, like, a bit lispy. When I was in recovery, my chest was getting really tight. And he was like, did you bring your inhaler with you? And I was like, no. And he was like, that's why it's good to bring your medication with you. And I was like, well, I can't use it anyway. I didn't say that to him, but he got me a nebulizer. And I think that stayed on for maybe 5-10 minutes and that really helped. On these it says freeze for at least 2 hours. They've been in well over 12 hours, so they're cold. I'm gonna take the warm ones out. I think this is supposed to help with inflammation. Oh my god, they're so hard. That really hurts. Might just leave it loose at the minute. Can't get comfy on the couch. It is now 2:45 and I fell asleep again. So I do need to have some food. I'm kind of stuck at the minute. And then my sting is down there. I'm still tired. Like, absolutely shattered. So who knows, I might fall asleep again. Also, can someone please tell me why my window does this? Hi. It's 5:40, still haven't eaten. I'm gonna have Oromorph, paracetamol and ibuprofen, and then I'm probably gonna have some soup. Yes, Stormy. Hi. They've switched shifts, so Kobe's having a break from being my little nurse and my companion. Yes, it is. It's kind of cute that they're trading off. But did I have to boot you off me because I was getting a bit too hot? Yeah, I did, didn't I? Stormy won't want a dinner, but I need to do medication first. Oromorph. Oh, I always forget to shake it. Hold on. 2.5 ml. Smells nice, doesn't it, Stormy? Paracetamol and ibuprofen. Hopefully I don't fall asleep before I get a chance to rinse my mouth out and eat. 2 paracetamol. Can't I just have me painkillers first, please? 2 ibuprofen. I'm really uncomfortable down here right now. This is what I'm going to be having tonight. I'm going to be having like half of it. So this is my amazing dinner that I cannot wait to eat. It feels very weird. On a happier note though, this afternoon I did wake up to the news that Secret Lives of Mormon Wives has got a 2nd season. I finished my dinner, so I'm gonna put these in the microwave. So this morning Kobe was messing around down here and I pulled the bin back and there was like a spider or like, and it was quite a big one, so I'm hoping that that was the spider. You comfy dude. Thing. Hello. Hi. Oh my god, hi. Oh my god. Oh, okay. Hi, thanks. What the heck is going on right now? Hi. There we go. Oh, of course. As soon as I zoom out, Stormy goes. It is 7:10 and I am shattered again. I'm still trying to get through this episode of Unsolved Mysteries. I hate to do this, but I do need to go and rinse my mouth out. Thanks. I'm not going to show you me rinsing my mouth out again because you've seen it twice. It's 9:30 and I'm getting a bit peckish, so I might go get some ice cream. I am feeling exhausted again. It's 9:45 and I think I'm going to start getting ready for bed. Probably going to be sleeping like this again tonight. It wasn't that bad last night, so I should be fine. Even though I slept for the majority of the day, I'm still tired. Good night, and I will see you in the morning. Good morning. It's 8:30 and I'm in a lot of pain today. Let's get up and get pain meds. I had a bit of my shake for breakfast, so I'm gonna rinse my mouth out. I'm now gonna sit down and watch a movie. I think I'm gonna do Miss Peregrine's Home for Peculiar Children because I haven't watched that in a while. The cat litter trays do need doing today, but I think we'll see how I feel. I'm about to rinse for the 2nd time today. This is how the bruise is doing. I'm due to have painkillers in about 10 minutes. I'm really hoping that my Oromorph will last the whole day. And then I'm probably going to have a nap after I've had my painkillers. Just made a delivery order for some more ice cream. Getting like big Ben & Jerry's tub. Got 2 melt-in-the-middle ice creams because... Not melt-in-the-middle ice creams. Melt-in-the-middle desserts because they're quite soft. My delivery was here. I got these melt-in-the-middles. Cookie of a Monster. Half-baked chocolate fudge brownie. I feel like I'm starting to feel pressure from the top ones. It is 10:50 and I'm starting to get a bit hungry, so I might have some soup. And then I'm also going to do one of the melt-in-the-middles. The melt-in-the-middle is done. Do we think he's comfy? I have to say, it is nice and warm where he's been though. I decided to get some sorbet and I'm going to watch Love is Blind. I'm in so much pain. It is 8:30 and I am getting ready for bed. I'm shattered. I'll see you in the morning. The cat litter trays do need doing today, but I think we'll see how I feel. I'm about to rinse for the 2nd time today. This is how the bruise is doing. I'm due to have painkillers in about 10 minutes. I'm really hoping that my Oromorph will last the whole day. And then I'm probably going to have a nap after I've had my painkillers. Just made a delivery order for some more ice cream. My delivery was here. I got these melt-in-the-middles. Cookie of a Monster. Half-baked chocolate fudge brownie. I feel like I'm starting to feel pressure from the top ones. It is 10:04 and I'm starting to get a bit hungry, so I might have some soup. And then I'm also gonna do one of the melt in the middles. The melt in the middle is done. Do we think he's comfy? I have to say, it is nice and warm where he's been though. I decided to get some sorbet and I'm gonna watch Love is Blind. I'm in so much pain. It is 8:30 and I am getting ready for bed. I'm shattered. I'll see you in the morning. Good morning. It is Monday morning. I slept awfully last night. This is also becoming very uncomfortable and my jaw's really sore. Good morning. I am 4 days post-surgery. I think I can feel the pressure of like the gaps more, if that makes any sense. Today I have... I'm molting. Honestly, I lose so much hair after I have surgery. Today I have my follow-up at the fracture clinic to put some body spray on. I inhaled it. So it's not great news. It's not bad news, but it's not great news. They did the x-ray and he said that he couldn't see any healing on the x-ray, which basically kind of means that they don't think it was a stress fracture. So they don't know what it was. He said that the only way to really see if it was a stress fracture would be to do an MRI. But he said if you're not in pain and if you can mobilize it today, I wouldn't recommend an MRI. But he has said that he will leave me open for 3 months. I've got a 3-month window. So if the pain was to come back, then I could go in, get the MRI done. It's not great news because I don't have an answer, but my mouth was getting very uncomfortable. I might put some heat on. I've filmed a bit today for TikTok and I also used a straw, but I didn't think I sucked that hard, but I feel like I might have dislodged this stitch even more. Feels weird when I swallow. I'm gonna see how it goes overnight, and if it still feels weird tomorrow, I think I'm gonna book an appointment with the dentist just to get it checked, because I wasn't told what to do if I had complications. I just feel like there's more pressure when I swallow. Hopefully I've not moved it. I actually slept lying down on my side last night. It was the best night's sleep I have had since Saturday evening. Tell me why my cat loves to destroy things. Stormy, I swear to Santa Paws, you carry on doing that and you are getting nothing for Christmas. Stormy, do you want Santa Paws to know that you've been naughty? Because just remember, he sees you when you're sleeping and he knows when you're awake. He knows when you've been bad or good. So please, be good for goodness sake. As if that's ever gonna happen. I have just made a dentist appointment. I have it on Friday. I just thought like it is a bit painful, so I just asked if I could have a dentist look at the stitches. Stormy, I swear. Is there any need? This cat is gonna be the death of me. Stormy is having fun testing my patience. Good girl, you gonna sit down? Good girl. I was watching Lauren Norris's new video last night. Was her decorating for fall and Halloween video. She's just recently got a new kitten, Lemon, who was being a little bit naughty. And I was literally like, why is my almost 1-year-old cat just as naughty, if not worse, than that baby kitten? Yes, she can sit when I tell her to, but she's also the devil. Yes, you are. Don't try and be cute. She's adorable, but she's also insane. Good morning. It is day 6 post-op. Feeling a bit better. Still on the paracetamol and ibuprofen. Oh, he knows. 10 p.m. and I've only really had like 2 meals today and I'm quite hungry, so I'm gonna go make pasta. Hi, grumpy girl. I'm sorry, I'll put the other one on. There you go, you're in the darkness now. Okay, let's make pasta. Pasta is done, so we're gonna go and eat it in bed. Good morning, I am day 7 post-op. So I am all finished at the dentist. He was like, yep, you got a loose stitch. I knew it. He put a dressing on. It's like a clove dressing. He also said that the other 3 teeth are healing really, really well. This one started to close over, this one hasn't, probably because it's been open. And I think this patch is gonna help that. I don't know how, but he said don't rinse out for a couple of hours, leave it in for a couple of hours, and then I can rinse. It is 20 past midnight on Saturday morning now. I filmed today for a recovery day in my life.
Good morning. I am day 8 post-op. I'm feeling more human again today.
I'm still getting some pain, so I'm still taking paracetamol and ibuprofen, also to help with the swelling, because down here there's still quite a bit of swelling. And this was the one that's caused most issues though, like before I had it out, and is one that's continuing to cause issues after. I honestly don't know if that patch yesterday did anything to help, but I guess we'll see. It is still like a bit painful, and I do feel pressure when I swallow, so who knows. But I think tomorrow will probably be the last day of updates, and then I'll just update in like different vlogs maybe going forward, because I think this video is going to go up tomorrow.
Good morning. It is day 10 post-op and I am in a lot of pain, so I definitely think I'll be calling the dentist tomorrow to try and make an appointment. But I am going to try proper food today. I've tried eating proper food and it was very weird. I'm still in pain with this one, so I will definitely be calling the dentist tomorrow. That's probably going to be the last update of this vlog. Thank you for watching this video. Give it a big thumbs up and hit the subscribe button. I will see you in my next video. Bye.